Did you notice that you woke up with vertigo after having acid reflux? Some of my patients have had this type of an experience after a fantastic Italian dinner or spicy food or maybe alcohol consumption, carbonated beverages. These are all things that can cause acid reflux, even in people who have never been diagnosed with this as a medical condition. And for many of my patients, this is a notable symptom that precedes them waking up with vertigo either in the middle of the night or first thing in the morning. When I've talked to my patients about the anatomy and physiology behind the link between acid reflux and vertigo, many of them are horrified. So today we're going to talk about the anatomy and the physiology of the link between reflux and vertigo. But first, I'm the vertigo detective, Dr. Kim Bell. I'm a licensed physical therapist with a private practice in San Diego County, and I only work with patients with dizziness and vertigo. Now let's get into it. When you have acid reflux, you may have been diagnosed with that, which would require you to actually report it to your doctor. Many patients don't ever report it to their doctor because it's not happening to them all the time. If you are having frequent acid reflux, you may be diagnosed with a condition called GERD, G-E-R-D. And this is an actual disease of someone that's having chronic acid reflux. But it can really happen to any of us after we have certain food triggers that can cause stomach acid and even particles of food to backwash from our stomach up into our esophagus, either later that night if we happen to burp or something like that, or while we're in bed that night sleeping. So when you have reflux, even if you've never been diagnosed with GERD, anyone can have a burp or lie down to sleep at night after certain food triggers and experience these particles of food or stomach acid backwashing into their esophagus. There's also another condition I want to mention called LPR, and this is silent reflux. I've had many patients with this who don't experience any symptoms like chest pain or heartburn. In fact, they don't even know they have chronic reflux until they have a doctor, like an ear, nose, and throat doctor, that actually views their throat and sees damage, esophagitis in their throat from the silent reflux. So this can affect someone with LPR. This can affect someone with GERD. Those are two diagnosed medical conditions, but this link between reflux and vertigo can actually affect someone who has only had reflux one time after a certain food trigger. It only takes one time for the stomach acid and the food particles to backwash into your esophagus. And then if you happen to be lying down, either while that occurs or shortly thereafter, the stomach acid and food particles can actually go up your esophagus and out to your ear. When I have explained this physiology to my patients, they were horrified. So stomach acid and even possibly food particles are actually traveling from the throat through the eustachian tube into the ear. And that can cause notably two different conditions that I've seen. One is called acidic labyrinthitis, which is an inflammation of the ear caused by the acid. Hearing is typically affected in these patients, and they typically have some combination of dizziness, vertigo, or imbalance while they have that acidic labyrinthitis, which is inflammation of the ear from the stomach acid. The other condition that I have seen immediately follow an episode of reflux is BPPV. That's the inner ear crystals that cause vertigo most commonly if someone has an inner ear cause of vertigo. So whether they have BPPV or acidic labyrinthitis, the root cause, which has horrified many of my patients, is literally stomach acid and or food particles going out through the eustachian tube from the throat to the ear and causing the problem. So what do we need to do for these patients? Well, what I do in my practice is twofold. First and foremost, I treat whatever inner ear diagnosis I'm able to assess for. So if I find that they have the BPPV, which are the loose ear crystals, then certainly we treat that. But if they have a presentation that's more similar to the acidic labyrinthitis, then we may need to give them a period of a few days for the inflammation just to calm down. It's possible they may need some medical management for the reflux. Some patients will have a medication they take all the time. Some patients will have something they can take occasionally, and that needs to be determined by their medical doctor, or like a primary care doctor, an ear, nose, and throat doctor, or a GI specialist. Other patients will just use certain natural over-the-counter supplements to take as needed if they notice stomach acid or food particles coming back up after certain meals, foods, or beverages that commonly cause reflux. Many, many years ago, my integrative neurologist recommended to me a specific product that I like to use when I have excessive stomach acid, and I want to show you how to find it now. Okay, so this is my website, betterbalanceinlife.com, and what we're going to do, I've actually written 2 articles about the link between vertigo and gut-related problems that you might be interested in. So what we'll type into the search is the word reflux, and then let's hit return and see what comes up. Okay, so that if you search for reflux right here, search reflux at betterbalanceinlife.com, you'll find both of my articles on gut-related vertigo. One is called Reflux and Vertigo, What is the Link? That's what we're going to look at together. And the other one is down here called The Gut and Vertigo. And as you can see, the Gut and Vertigo has over 400 comments. This is actually the most popular article I have ever written, and we'll talk about that in another video. But for now, I want to focus on the reflux article that I wrote here for you. So this actually has a lot more detail about reflux. This talks about GERD and LPR, the 2 medical conditions I mentioned at the beginning of this video, acid reflux, GERD, and LPR. This talks about acute acidic labyrinthitis and BPPV, so that's a little bit of a review of what we discussed. This talks about common food triggers, such as mint, onions, garlic, coffee, tea, alcohol, chocolate, carbonated beverages, and soda. Also notoriously spicy food, Italian food, all that good stuff, all the good stuff. Okay, so these are some symptoms of acid reflux disease, if you're not sure, but burping, nausea, bloating, heartburn, coughing, a chronic cough, losing your voice. Those are all potential symptoms of acid reflux. In this article, I have some tips of how to minimize reflux. Now, let's go over those together. You can avoid lying down for at least 3 hours after you eat. And so therefore, you want to avoid midnight snacking. I know it's hard. After you eat, avoid vigorous exercise and avoid bending over. Walking is fine. Prop up at least 30 degrees in bed using a wedge to reduce your reflux and vertigo. And some people actually use extra tall bed risers under the head of the bed. So you would put those under the 2 legs at the head of your bed in order to give you that 30-degree incline all the time. Very important also to lie on your left side to reduce reflux, because lying on the right side actually tends to make it worse. Although I will say that I've had some patients tell me they feel like their reflux is worse lying on their left side. Surprisingly, I think that might have to do with their individual anatomy and the angle of their stomach as it's situated within their abdomen. I'd say that's the exception to the rule. For most patients, the acid reflux is best lying on the left side and worse lying on the right side. So let's keep going through this article. This talks about more of our hypothesis about acid reflux and vertigo, talks about talking to your doctor. And this is what I wanted to get to here. You can look at this article on your own if you want to read more information, but I wanted to get right down here to this product, this is what my doctor recommended to me. Now, keep in mind, this is not individual medical advice because I don't know if you even have acid reflux or if this product is right for you. Definitely talk to your doctor about it before trying any new product. But this is the product that my doctor recommended to me that I love and I recommend to many of my patients. It's called Acid Balance. So let's click on that. And we see here it's at the website called Maharishi Ayurveda. And I just take this as needed if I have symptoms of acid reflux to prevent vertigo. I hope that video was helpful. See you in the next one.